Welcome to TechnoViews, a new series of podcasts with major figures in the humanities and social sciences on topics at the intersection between technoscience, culture, and society in Asia and the world. My name is ZHANG. I'm an assistant professor at City University of Hong Kong. In this podcast, it's our pleasure to have Dr. Lyle Fearnley from Singapore University of Technology and Design. Dr. Fearnley is an anthropologist of science and medicine. He recently published his book, Virulent Zones, Animal Disease and Global Health at China's Pandemic Epicenter, with Duke University Press in 2020. Welcome, Lyle, today in joining us in our podcast.
Well, thank you. I'm very happy to be here. Yeah, thank you very much for the invitation.
I actually come across your work from a sort of article piece that you publish on The Conversation. And when you talk about shut down the web market in China would be a terrible idea. And I look at that piece and I feel actually quite thrilled and thinking, well, finally someone is talking about that issue. So because of that piece, I tracked down your recent publications, the book about the influenza. I think your book wonderfully captures how complex it is to trace, to develop knowledge about, and to try to control zoonotic disease. So let's talk a little bit about your book. First of all, your book is about influenza. What is influenza? And in what ways is influenza comparable to COVID-19 from the perspective of public health?
Yeah, that's a very good question. I guess influenza, very simply, is the disease that we normally call, like in English, the flu, or in Chinese, the yougan. And it's a very common disease that spreads almost every year. And it's caused by a virus, which is known as the influenza virus. And so, however, the disease was known about before the virus that caused it was discovered. So there was influenza outbreaks and even influenza pandemics that were tracked from the 19th century into the early 20th century. But the causative virus, now known as influenza virus, was only discovered in the 1930s. One other very interesting aspect about influenza is this difference between influenza seasonal outbreaks and influenza pandemics. And so that's something that epidemiologically in public health was noticed, that in certain years there would be a very widespread of influenza across the whole world. So the most famous one, of course, being the 1918 to 1920 flu pandemic, which killed a very large number of people around the world. And so the one thing about that is what causes. So once there was the discovery of the virus that causes it, what they realized what causes influenza pandemics is a new strain. So it's a sort of a new variant strain of the flu virus, which would be one that the human population would not have any immunity to. And that's what enables it to spread so widely. So this is where we get into some of the ways that influenza is quite similar to, or has some similarities to, the SARS coronavirus 2 that causes the COVID-19 disease and pandemic that we're experiencing right now. So similar that they're both caused by viruses rather than bacteria is one important similarity. And another one being that they spread when, because it's a new virus or new strain that's spreading into the human population. And then maybe I'll just add one more thing before I go on for too long, but that another key similarity that I talk about in my book is that during the 1957 influenza pandemic, which was originated in China a Chinese virologist named Zhu Jiming actually sort of theorized or hypothesized that this new strain, for there to be such a large variation in the influenza virus from the seasonal flus that were spreading before, it would be unlikely for that to happen from the normal mutation of the virus among humans. And instead, it was likely to have leapt from animals into humans. And similarly, the most sort of the predominant or theory for how the SARS coronavirus 2, or similarly to the SARS virus in 2003, how those began to spread in the human population is that they jumped from an animal reservoir, animal host into humans. That's why humans don't have any immunity to it. And that's why it can spread basically so widely and quickly.
Well, that's very interesting. A lot of the disease that you mentioned, like such as the SARS, and also other kind of disease such as the like H5N1s that you mentioned in the book, sounds really familiar for someone like me who grew up in South China. It's sort of almost like an from now and then you will see that in TVs, in newspapers, and so on and so forth. I find your book title is very eye-catching. It's called, quote, China's Pandemic Epicenter, unquote. And I think these terms may resonate with quite a lot of people's sentiments today, particularly concerning, for example, the, let's say, resurfaced discussions about the origins of the COVID-19, currently in some of the social media. Could you tell us a little bit more about what you mean by pandemic epicenter and where is it?
So in the case of influenza, there's this term, it has a very specific history, which is why I introduced it in the book. So as I mentioned, the 1957 influenza pandemic, based on research by Chinese virologists, the origin was theoretically located somewhere in China. And similarly, the 1968 influenza pandemic, which was referred to actually as the Hong Kong influenza pandemic, was also theorized to probably have originated in China somewhere. And what happened in the 1970s is a series of researchers began trying to understand better how it is that animal hosts could give rise to these new influenza strains. And they basically began to look at something that would be like a kind of ecology of this virus. So what kind of interactions between animals and humans would lead to the emergence of these new virus strains. And what they came to think about was the certain relationship between especially ducks, which are the primary reservoir for most of the influenza viruses, and then the relationship between ducks, pigs, chickens, and humans as being sort of the ecological arrangement that might give rise to these new strains. And in particular, there was a researcher based at Hong Kong University named Kennedy Shortridge, who was working throughout the 1970s sampling viruses and studying them. So sampling them from mostly domestic duck, domestic chicken, domestic pig, and some wild bird populations. And he was demonstrating that basically a very wide range of viruses are held in the domestic duck population. And based on this, he made the sort of hypothesis that southern China, and this is his term, could be an influenza epicenter. What he meant by that is that using sort of the idea of epicenter from seismology and earthquakes as sort of the central point out of which this force radiates outwards, he was suggesting that because of certain ecological conditions of farming of ducks, chickens, and pigs in southern China, that made it especially likely to be a sort of origin point for these pandemic flu viruses. I have some other, sort of critical discussion of that in the book that I could go into more. But that would be the reason why the China became first identified as this with this term as influenza epicenter or pandemic epicenter.
Well, that's quite intriguing since China become identified as the epicenter. Um, there's a term you also mentioned in your books that is called, quote, geography of blame, unquote. I think this is it seems that this term quite captures a lot of the things that is actually going on, with the COVID-19 too. So can you say a little bit about that term? What is the geography of blame?
Yes, that's a very interesting question. So, geography of blame is a term actually first introduced by the medical anthropologist Paul Farmer in his book about AIDS and HIV in Haiti. And he was arguing in that book that, well, he basically showed in that book that some of the early scientific reports about HIV and AIDS from US, so American based scientists and doctors were arguing that Haiti was the possible or probable origin for HIV. And what he pointed out was that they were utilizing what he calls like a folk model of Haitian culture as being sort of I mean some of the he says like that in this folk model Haitians are like primitive people engaged in voodoo rites involving throwing blood around and eating corpses or things like that. And so sort of a very kind of vague and exoticized rendition of Haitian culture was used as sort of a kind of evidence to support the hypothesis that Haiti was the origin point of the HIV virus. When in fact, as Farmer shows, that subsequent sort of epidemiological research and virological research and so on was able to show that it's much more likely to have actually been the other way, that actually this virus probably spread from the United States, was in the United States first and then spread to Haiti. And so what he means by here, the geography of blame, is sort of how there's a certain geographical distribution of blame and responsibility for these disease outbreaks and pandemics. And certainly, so I use that term as well to think about how China, by being identified as as a pandemic epicenter, it creates this geography of blame in which a certain place and a certain set of cultural practices maybe becomes identified as responsible or blameworthy for these outbreaks of disease. And so it's a certain logic of identifying responsibility and accusation for pandemic diseases. And so I in some ways I try to do something similar to what Farmer was doing, because as I was mentioning, these people like Kennedy Shortridge talking about influenza, or similarly in the response to COVID-19, where there was a lot of talk about, at least especially at the beginning, a lot of talk about certain like wet markets or with sort of animals of all kinds being mixed together in these very sort of visceral descriptions that are and then also talk about like consumption of wild animals or wild animal farming. What's happening is how certain kinds of like folk models or sort of like vague cultural descriptions of the people in these places are being mobilized as evidence within actually scientific discourses about these origins, and that leading to a lot of accusations and blaming of people who engage in these practices. For example, wild animal farmers as being one in the case of COVID-19, pandemic. So in this case of the COVID-19 pandemic, you've had um, this idea that this spread from wild animals, and then it quickly leaping into this sort of these exoticized cultural descriptions about wild animal consumption. And the ultimate effect of this has been a lot of pressure put on, and then the eventually the government, China's government actually has prohibited farming of wild animals for food, which has put a huge number of people out of work. And so there's some real effects of this geography of blame in terms of who's getting held responsible, when in fact we have no evidence to say that any kind of wild animal farming actually played a real role in this outbreak.
Well, that's really fascinating. So actually, have a good example here too, to sort of illustrate your point about how a scientific discussions become a social one and a political one. Actually, in Hong Kong last year, quite at the beginning of the COVID-19, one of the leading medical experts came out to the public and said the reason why we have COVID-19 was because of the Chinese backward habits of wild animal consumption. But you just mentioned wild animal farmers. And I find that term very interesting, because farming wild animals sounds oxymoron. And if it's wild, then why was it farmed? So I would like to hear you to elaborate a little bit more about the agriculture production side of the story. How wild animals gets farmed, so then what makes an animal still wild when it is farmed, and how is that, as you said, in one way connected or not so connected actually to influenza?
Yes, so in my fieldwork related to the project on influenza, one of the main areas that I was looking at, in addition to scientists who were trying to contain the outbreak, was to actually look at the farmers who were being essentially held in some ways responsible and having to transform their practices in order to create more biosecurity and in theory to reduce the risk of disease emergence. And one of these groups of farmers, so some of them are just conventional duck farmers, chicken farmers, but there are also these wild bird or wild goose farmers. This became a major focus for the influenza researchers, which for them it was a huge surprise that this existed at this scale as well. And it was a major focus of their interest because they were concerned with how a virus might go from a wild bird to a domestic bird. And so they imagined that this farmed wild bird might precisely be the kind of intermediary between the wild and the domestic birds. So how did this practice come about? And maybe one other thing I would say that though is that in the COVID-19 situation, where there's been this large backlash against consumption of wild animals, some of it coming from environmentalists, for example, what immediately you realize is that the complexity of, if you say, banning wild animals, the complexity that emerges about how do you define what counts as wild, because such a large percentage of these the animals are actually farmed. Many of them, some of these species have been farmed for a very long time, others for much less amount of time. Some of these species are known to be risks of certain kinds of emerging diseases. So, for example, civet cats, which was associated with the SARS outbreak in 2003. But many of these species are not really associated with any specific emerging disease. So there's a lot of difference in risk as well. And there's a lot of difference in how these animals are farmed and treated in the farming production process. And so just then, how did this come about, this idea of farming wild animals? for the majority of them, such as like the wild swan geese farmers who I studied in my book, it was not something that is like a traditional practice. So you mentioned the word that people often use, like backward cultural practice or backward traditions. Or in some of the Chinese scientists who criticized it, they described it as like vulgar practices, or uncivilized. But in fact, most of this wild animal farming really emerged very recently. It's not that it's not a traditional practice at this kind of scale. And it's more of a response to the industrialization of conventional livestock farming. And as from the 1980s in China, as the livestock industry grew very rapidly, and it grew in scale to the point that it's heavily dominated by large industrial corporations. Small farmers still participate, but they participate usually through some kind of contract system to those industrial farm conglomerates. In that context, some farmers who sort of wanted to find some kind of way of differentiating themselves from that conventional market and maybe finding a more higher value item to produce began to look into these kind of unusual breeds, different varieties. One of these areas being farming wild animals. And for them, then, as you mentioned, then a huge concern becomes how to distinguish or ensure that they are still can be qualified as wild while they're actually being farmed. So the consumer will consider them to be wild birds while they're coming from a farm. So there's a little bit of an oxymoronic thing, as you mentioned. But so the trick is to identify some sort of key features of these varieties that might distinguish them from conventional livestock. So in the case of the wild geese, for example, they ensure that they're able to fly. They ensure that they're able to have certain visual appearances that are quite different from the conventional domestic goose.
That's really interesting. I grew up in South China. This kind of a wild animal, as delicacies on tables is sort of quite common things. But I've never heard about this kind of story. How you can actually farm them. I'm very curious. What motivated you to take on this topic for your research?
The beginning of looking at this topic was actually I had done some earlier research in the United States about public health departments and how they were dealing with the threat of a pandemic disease, or the threat of an emerging pandemic disease. And this was around between maybe 2005, 2007 that I was doing that research. And one of the things that really struck me at the time, so a lot of that was funded, it was funded at the time based also on an idea about bioterrorist attacks. So it was after the 9/11 attack in the United States. And so the US federal government was putting in a lot of money to anti-terrorists, counter-terrorist kind of initiatives. And so public health departments were taking some of this anti-terrorist funding ostensibly to build systems to detect a bioterrorist attack. But when you talk to people working in public health, they were saying, that it's not likely there's going to be a bioterrorist attack, but we are really concerned about a pandemic. And they also would consistently say we're especially, they're concerned about pandemics coming from China. So that really intrigued me about why China was being identified as this source and what some of the consequences of that might be. And so that's when I began to develop a sort of project about what does pandemic preparedness look like at the source in China, this hypothetical source, and how that might be different from how pandemic preparedness looks like in a place like the United States, where they're considering it as something coming from outside.
Among all the ethnographic materials that you did not include in the book, can you share with us one or two episodes that you would like to include in the book, but for various reasons that you could not?
Yeah, that's an interesting question. So I was thinking about that. It's hard to know what to say about that one, but it's a very interesting question. I think one area that I wrote about more in my dissertation and then took out from the book that I kind of regret and I might like to write about more is related to the informal, unlicensed veterinarians at the local level who treat the diseases of the ducks, chickens, and quail and geese and other birds, which I call in the book. I just call them duck doctors, and they're a very interesting sort of figure because it's the people engaged in that activity are not traditional again. So there's a very long tradition of veterinary medicine in China, dating hundreds, thousands, maybe thousands, hundreds of years back at least. But it was not so focused on some of these diseases of ducks, chickens, and quails and things like that, because the scale of farming of those animals was not large. The value was not so great. So the focus of veterinary medicine traditionally was on horses, pigs, and other cattle, larger animals. Secondly, they're interesting because they're not a state veterinary service. And so what happened in China from the 1950s to the 1970s, you had a huge growth in local level veterinary services provided by the state. But after the 1980s, you had interesting phenomenon where you had a huge growth in the huge growth in the production of animals, but you also had a decline of funding or withdrawal of funding for local veterinary services. And so one result of that is that you had the emergence of a sort of independent veterinarians that I call duck doctors. And the thing that I've left out from the book, so I discussed this background in the book, but what I've left out is some of the more ethnographic sort of encounters between the duck doctors and farmers that are quite interesting. And what I sort of discuss in my dissertation is how they really focus heavily on cultivating sort of friendships and relationships with the farmers, and that's a really important basis for their work. That might, in some ways, more important than becoming like a knowledge expert. And I think that what I think that could be relevant is that by contrast, you have, let's say, the state level and also the international agencies who are concerned about pandemic diseases. They focus very strongly on knowledge production, but they don't focus very much on cultivating relationships with the local farmers. And so you have this kind of gap between these two approaches that I think is quite problematic, because the expert science about influenza, they keep producing these, facts and knowledge, but without being able to develop these more close relationships to farmers, there's a kind of lack of understanding that is ultimately problematic in how to then effectively contain and control diseases.
Well, that sounds like you have another fascinating project to write on. I look forward to read about it. Thank you very much for your time today, and thank you very much for sharing your research and insight with us. You are listening to Dr. Fearnley talking about his book, Virulent Zones, Animal Disease and Global Health at China's Pandemic Epicenter, published by Duke University Press in 2020. Thank you for joining us today, and hope to see you soon.